While both the Obama and McCain campaigns are laying out very different health care plans, a grassroots movement wants the next president to put his money where his mouth is. Health Care for America Now has come out with a big ad campaign calling for action on new health care legislation. Watch.
Will they cover the chemo?
Will health insurance companies ever put your health before their profits? We can't trust insurance companies to fix the healthcare mess. If you're ready to demand quality, affordable healthcare now, join us.
Jackie Schechner is Communications Director for Health Care for America Now. And Jackie, I've heard reports that as much as $20 million is going to be spent as part of this campaign. Is that true? And where is the money coming from?
It's actually a $40 million campaign. We're going to spend that money between now and the end of the year, $25 million on paid media. And the money is actually coming. We have a grant from the Atlantic Philanthropies Foundation. That's a $10 million grant from them. And then we also have a commitment of at least $500,000 from each of our 13 steering committee members. That's the minimum. There's, of course, a lot more than that being contributed by some.
But, Jackie, very fair to say that these are groups that are sympathetic to Barack Obama?
You know, these are groups that support our principles. We have a statement of common purpose, and the idea is to win a guarantee of quality, affordable health care for everyone in 2009. And these are all groups that happen to support the same principles and the same common purpose.
Well, I hear what you're saying about the principles, but how would you respond to Republicans who say, look, this is just a front for people who want Barack Obama's version of health care, and they're trying to influence the election and to help Barack Obama?
David, these are people who want our version of health care. What we're asking people in this campaign is, which side are you on? Are you on the side of a guarantee of quality, affordable health care for everyone? Or are you on the side of the insurance industry to be left alone with the unregulated bureaucratic insurance market? We want people to take a side.
But by taking a side, I mean, the other argument to that is Republicans would say, look, if you embrace Barack Obama's health care plan or the health care plan that you're putting forward, you could actually hurt America's sort of creativity or take out the market incentive for coming up with new treatments.
You know, David, I think that there's nobody in the country right now who hasn't been through that moment where you get your health insurance bill, you open it up, and there's a charge in there you didn't expect. I mean, those of us who have insurance know what it's like. You pay your premiums, you think everything's going to be covered, and then you have that moment where the rug is really pulled out from under you. And that's what we really want to get rid of. We want to regulate the insurance industry, and we want to say, look, you've got to play by some rules. We want there to be really some limits on what you can charge. We want people to be able to have quality health care and affordable health care, something that's based on a sliding scale, based on the income of your family or the payroll if you're a small business. That's really what we're looking for here.
Jackie, the response in terms of Barack Obama said he doesn't want independent groups taking out ads on his behalf. Clearly, this is sort of a separate set of organizations, but the means, the goals are essentially the same. How do you respond when you hear Barack Obama saying to MoveOn and all these other groups, look, I don't want you out there helping me, and I suppose the same case could be made about the group that you're working for?
We're actually entirely separate. We're an issue advocacy campaign, and the principles that our campaign supports have actually been around for a very long time. This is an organization that's been in the planning stages really long before Obama ever ran for office. This doesn't have to do with getting him elected. We're going to ask the president and Congress, no matter who's in office in 2009, to really make a change and to really get us a guarantee of that quality, affordable health care.
Jackie Schechner, Communications Director for Health Care for America Now. Jackie, thank you very much, and you heard it from her. $40 million that this organization, the series of organizations are going to spend on the health care debate in this general election that will have an impact whether or not John McCain likes it or not, or whether or not Barack Obama doesn't want third-party groups getting involved.